Hello, and welcome to the GRACE podcast series. My name is Denise Brock, and I am the Operations Director for the Global Resource for Advancing Cancer Education, or GRACE. In this podcast series, we interview patients, advocates, and healthcare professionals to provide the most updated information for our community and to highlight important issues facing those dealing with a cancer diagnosis. We hope you find this information valuable. For questions or comments, please visit us at cancergrace.org.
In the first probably 20 minutes or so, we're just going to be reviewing what is the current data in terms of bone marrow transplant outcomes in patients with myeloma and lymphoma. I have no disclosures at this particular point. So the outline of the presentation is we're trying to first define what is a bone marrow transplant, or what a bone marrow transplant entails. What is the definition of autologous bone marrow transplant? What are the most common indications for this subtype of transplant? And then finally, we're going to review the survival for both lymphoma and myeloma. I always like to start these conversations by looking into, of course, this is nothing that we have to remember at this particular point, but like to just kind of look into where we are. This is the hematopoietic system. I always try to, when we start a sort of an idea, give us an idea as to where exactly we target or where we are working in terms of multiple myeloma and also lymphoma. As you can see here, this is what we call the stem cell, or the multipotential or hematopoietic stem cell, and this is the sort of the different sort of the lymphoid and the myeloid sort of pathways. And here we have on this side of the slide, the B lymphocytes, in which we're going to concentrate, and this is where the majority of lymphomas develop. And on this side also we have the myeloid cell. Where we have, sort of the plasma cells. So one of the first concepts that perhaps we need to just kind of make sure that we understand is a bone marrow transplantation equals to a stem cell transplantation. Sometimes we have this kind of two definitions, and they're about the same for certain caveats as we're going to go along in the presentation. So the first topic that we're going to discuss is what is bone marrow cell transplant. Whenever we have a patient with either myeloma or lymphoma, first, of course, we need to treat these patients. And of course, once we achieve something that we call a complete response in the case of multiple myeloma, also complete remission in the case of lymphomas. So we consider the option, of course, of bone marrow transplant. And the definition of autologous bone marrow transplant basically is a transplant for using your own stem cells. Along these years, I noticed that, of course, the bone marrow transplant does not entail anything surgical. It's just the placement of a line. And basically, the Society of Bone Marrow Transplant has changed its name about a couple of years ago, and now is called Transplant and Cellular Therapy, because that's where it truly happens. What we usually do, excuse me, once we have a patient who is in complete remission, we collect the cells via a catheter. We place a big catheter, and then we collect some of these cells. And of course, we just kind of start processing these cells to obtain those kind of CD34 stem cells that we saw in the previous slide. And then we can either prepare it and put it in a special place in the lab, and prepare the patient for something that we call a conditional regimen, meaning more chemotherapy, to make a space for these stem cells and then put these stem cells back to the patient. So this is basically the same patient donating himself, if you will, those bone stem cells. This is called an autologous bone marrow transplant. Of course, this is a very simplified version, but this is what usually entails. There are many different steps in between all the different parts of, as you see here, in the collection, processing, and the reinfusion. There's so many different sort of multi-processor, or I guess sub-processes are going on those different processes. This item of cryopreservation, this was used lately because of the COVID-19 pandemic, and of course we use that as a sort of a make sure that our cells are viable. And this was used more in terms for patients who or had donors in the second kind of transplant that we're going to review. So this is autologous stem cell transplant. Basically, you're donating your own cells, your own stem cells. And this is something that we do for patients with myeloma, lymphoma, and many other conditions. Still, we do it. With the advent of any other new therapies, things are changing, of course, as we're going to discuss very likely in the Q&A discussion. But this is what we have at this particular point. Continues to be the standard of care for many conditions, meaning that depending on the circumstances, if there's truly indicated for the autologous bone marrow transplant. So then we have a second sort of transplant that we're not going to talk much today, which is the allogeneic transplant, in which you get cells from a donor. This is more, perhaps a bit more complex sort of a process. As you can see, once again, we need to make sure that this patient is in complete remission. This is usually used for other entities, exceptionally for myeloma and lymphoma. Usually this is used for patients who have acute leukemia. And of course, whenever we have this, again, you see kind of a similar process, but the collection happens from a donor who is a match. And the process of obtaining a match, of course, is very complex. So there's a different steps, different process. You look into the registries and so forth. Of course, look for siblings first, followed by registries, followed by other different perhaps family members. And then, as you can see, kind of similar process. We have a collection here. We have a processing. There is more, logistically challenging sort of processing process to deal with the stem cells from a donor. Then we, in some occasions, we cryopreserve it, meaning we're put in a special place just to, because of circumstances, sometimes we don't use it right away. But if we can use it right away, of course, we deliver the chemotherapy, which is induction therapy, and we infuse these cells to the patient. This is the allogeneic transplant process, which is a bit different compared to the autologous transplant process. But of course, to work in a bone marrow transplant setting, it's not really quite easy. You need intense logistics. Of course, you need expert staff members. You need laboratories. We need stem cell process and immunotherapy laboratories. We need to closely work with outpatient and inpatient facilities. We do have sort of housing facilities, like in our case, we have for our patients close in one of the Hilton hostels that we have at this point. And of course, we need to just kind of have close connections with the national and international donor registries, which can provide us with some of the donor cells when we need it.
Thank you again for joining us. This podcast was made possible by the generosity of sponsorship from our friends at Lilly and Exelixis. Please like and follow us on Facebook and Twitter. Send us feedback, share your story, donate, and visit us for more information at cancergrace.org. Thank you for listening.